Welcome back. In video 5, we'd like to cover navigating family, friends, and social boundaries. When it comes to relationships with others, this takes personal discretion. Some relationships may need to be dialed up, and others may need to be dialed down. And by the way, the suggestions we shared in the last 2 videos on the partner and child dynamics are helpful in any relationship. Consider watching those for additional tools outside of your immediate family context. And in this video, we will focus on 5 tools we know to be helpful in relationship with others.
All right, so the first is setting boundaries. Use clear language when telling family or friends you'll need to leave early or not attend an event. Remember, boundaries are not meaning to push people away. They're actually a very kind way to tell people how to love you right now. You don't need to explain why. You can just state your plans. We have to miss this event and hope to make it next time. Or we will need to leave at 6 p.m. tonight to go home. Or we're unable to make the baby shower.
Setting boundaries is an essential coping skill during fetal care. Many parents feel pressure to share updates before they're ready or to pretend they're okay to make others feel more comfortable. There can be perceived or real pressure to keep up with your old schedule, but you are allowed to protect your emotional space. Clear communication about what you need and also what you don't need can actually strengthen your relationships. The people who care about you will respect your limits, and those limits will give you energy to keep caring for your baby, yourself, and your family.
Second, share your story. Telling your story brings life and it reduces isolation. You might be in the middle of the story, seeing the light at the end of the tunnel, or maybe you are grieving an outcome. Whether you are naturally introverted or extroverted, you are wired to share your story in some way with someone. Say your baby's name. Don't be afraid to say how much you love them, or that you're scared to love them, or that you're so deeply saddened by their anomaly. And in the right place within the right relationships, sharing is critical. And we encourage you to step out in faith and tell your story, especially when the end is not written.
Third, incorporate baby into your family. Whether you're pregnant, postpartum with a living child, or postpartum after loss, your baby is part of your family. As you're able, find ways to include them and celebrate them. Maybe it's holding a memory with them being there. I'm so glad baby's name got to see the ocean today, for example. Maybe it's including them in your birth order, whether they have siblings yet or not. Again, when and where you're able. You can also keep your baby in your traditions, like buying a special ornament for the tree or keeping a small keepsake from a family trip to represent their place in your story. Saying their name, as Dr. Diana mentioned, is another way to communicate they are part of your family.
And fourth, remember you stand on common ground. Your story is unique, and yet you share a broad experience of complex medical care or fetal care or surgery with thousands of other families past and present. And remember, 1 in 33 babies have a congenital condition. If you're in a crowded room, chances are you have more in common with the others than you know. Carry Me Health is here to help you connect with those families. We also recommend finding a condition-specific organization with resources. And we're here to coach you and point you in the right direction to find this. Your care center may also have peer support initiatives. It does take effort to step into community, but it helps you remember you stand on common ground with others. Encouragement, information, hope, action, these will all grow when you connect with others who share this experience.
Fifth and last, avoid comparison. Comparison has been a struggle since the beginning of time, so hey, this is not easy and you're not alone here. Even with fetal anomalies, we start comparing length of pregnancy, magnitude, outcomes, surgical treatment involved, everything. Avoid comparison. Every baby and family situation is truly unique. Comparison can damage relationships and support, and you need both right now. Comparing yourself or your fetal diagnosis to others negatively impacts mental health, fueling anxiety and depression. This is especially true on social media, where we often compare our behind-the-scenes struggle to everyone else's highlight reel. If seeing perfect pregnancy announcements or healthy baby updates is triggering for you, it's okay to hit the mute button. Protect your peace on your feed and that's part of protecting your mental health. Recognize what you share with others instead and where you can identify with one another. Flip the script and find what you're looking for, which is relationship.